There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what is white coat hypertension? Blood pressure varies over the day and night rhythm. According to what you do, whether you're tensed, anxious, nervous etc. lower during the night, lower if you're relaxed. When you exert yourself, the systolic, upper, pressure rises, the diastolic, lower, pressure goes down a little. If one is anxious and tensed, it goes up etc. Many people, because they're anxious on the outcome of the blood pressure measurement in the doctor's office, will cause their blood pressure to falsely rise. That is what we call the white coat. White equals color of the doctor's coat. Hypertension. In my erstwhile doctor's office, we used fully automated blood pressure monitors to measure the blood pressure intermittently without somebody besides the patient being present, positioning the monitor in such a way that the patient can't see the values that were recorded. This monitor can register the values measured over time, so gives us a really good idea what the real blood pressure is by us disregarding the few first obviously falsely elevated values. Some people I recommend to buy validated self-measurement blood pressure monitor you can find on page on dableeducational.org, measuring their own blood pressure daily at home, so getting used to the procedure and not being tensed about it anymore. You should also understand that according to protocol, we repeat the measurements until we find two values no more than 5% apart. The earlier higher values we disregard, the mean of which we see as the real value. So just one measurement not repeated if often falsely elevated. Buying an unvalidated device to use is a waste of money since nobody can tell you what to do with the results. From long-term prognostic value of white coat hypertension, an insight from diagnostic use of both ambulatory and home blood pressure measurements, people having white coat hypertension eventually will develop real hypertension and have an elevated risk for cardiovascular disease and mortality, so need to be followed up. But in older people, only having white coat systolic hypertension doesn't influence how many cardiovascular events they will experience. Significance of white coat hypertension in older persons with isolated systolic hypertension. I hope that helps. If you need more answers and advice on hypertension, I've included some links in the description.